college student arrives in A&E with an open wound on the dorsum of the hand, with a piece of tooth in the wound. The patient reported to have a bar brawl last evening. Closed fist injuries are encountered almost exclusively in young males. The physical examination reveals a puncture wound that is swollen, red and painful. The wound is likely to be infected. Patient with infections may have elevated temperature, swollen glands, and a history of fever. And the loss of motion or sensations in the finger suggests that the tendon or the nerve has been severed. If flexor tendons have been severed, the patient are unable to extend or flex some portion of the finger. When the nerve is lacerated, there is loss of sensations over the tip of the finger. Closed fist injuries often result in extensor tendon injuries and its sheath. When a closed fist injury occurs to someone with a clenched fist, the bacterial load is often carried back in the hand as the tendon slides back to its relaxed state. This means that the problem of contamination cannot be easily resolved using normal methods of irrigation and cleaning of the wound. Abscess formation also can develop. For diagnostic studies, a wound culture are used to diagnose infected organism. Aerobic or anaerobic cultures should be included. Human bites, the most common infectious organism is Staph aureus. Others are Streptococci and Echinella corrodens. For cat bite, these are Pasteurella multicida. In dog bite, Staph aureus, Streptococcus viridans and Bacteroides, as well as Pasteurella multicida, may be cultured. All patients lacerated with the metacarpophalangeal joint should have X-ray to find out any foreign body retained teeth, regardless of the patient's reported history. Radiograph helps to exclude fractures or foreign bodies. Well, radiograph also determines if there is any osteomyelitis. The differential in that can be puncture wound, insect bite, animal bite, and marine animal bites. While discussing human bites, there are two major mechanisms of human bites to the hand. A penetrational trauma is a closed fist injury in which one person strikes another in the mouth, causing a fight bite to the hand. If the hand is in clenched fist position, laceration of the skin or the knuckle may damage a tendon sheath or tendon as well as surrounding tissues or underlying bones to the joint. The most common site of injury is the third and fourth digit at the metacarpophalangeal joint. Osteochondral fractures can also occur. Bite wound of the hand can cause cellulitis and abscess formation. Human bites are particularly virulent because of the gram-positive and anaerobe bacteria present in the mouth. Regarding non-surgical management, patient who has presented less than 1 day following an injury with no signs of sepsis and wound exploration, swabbing of aerobic and anaerobic cultures to determine antibiotic treatment may be sufficient. Treatment with antibiotic and close observation is mandatory. If the treatment is undertaken within 8 hours, then wound may be closed, whereas any wound which comes after that should be left open. Close observation in all cases must be performed. Antibiotics like penicillin G, ampicillin, carbicillin, or tetracyclines can be advised. For dog bite, most susceptible organisms are sensitive to penicillin. Tetanus prophylaxis should also be included while using antibiotics in dog bite injuries. Similarly, Pasteurella multicida is also sensitive to penicillin. In the patients whose treatment is delayed, a surgical intervention may be indicated. Open drainage and irrigation may be necessary. A wide open incision should be used for irrigation debridement. Several liters of fluid should be used for irrigation, and close observation with IV antibiotics while inpatient. Frequently, the tooth will penetrate the metacarpophalangeal joint where the cartilage is particularly sensitive to infection. Every puncture wound near the proximal knuckle should be treated aggressively with exploration, irrigation, antibiotics, and drainage. Try to note that human saliva is also having about 10 million bacteria per milliliter, and the infection risk is quite high. That's why it's a protocol not to close human bite injuries. Anyhow, animal bites are sometimes loosely approximated. That can be done especially for cats. Post-operatively, after the debridement, the bites are wrapped with bulky dressing and motion exercises are started within 24 hours. A follow-up visit is mandatory after 48 to 72 hours after the treatment. The complication which can occur of the bite is osteomyelitis, which frequently reported in cat bites, fractures, joint stiffness, and arthritis. Less common complications include digital amputation, systemic sepsis, and death. While doing surgical drainage, it's highly recommended not to go laterally while opening the metacarpophalangeal joint.